Welcome to News West 9's West Texas View with Johnny Lou Avery.
Welcome to the West Texas View. I'm Johnny Lou Avery, and it's a real pleasure to invite and have accepted Dr. Bobby Jane back to the studio this morning. He has been on several times before, and after each time we have a lot of questions that come in to him, and one of the most interesting, Dr. Jane, was a father called, and he said, my son, who is now a freshman in high school, is very interested in going into medicine, and after seeing Dr. Jane, was very interested in the field of psychiatry because you said that there was not very many psychiatrists out, particularly in West Texas, but all over. And so he was very interested in that. And so how would you suggest someone like him could get more information about it so that they know whether that was really something that they were interested in?
I think that's a very good idea, and I would do encourage folks to look into this field. It's a difficult field to deal with, but at the same time very, very rewarding when you make changes in lives of your patients. What I would recommend is the first thing to start would be to approach the school counselors. School counselors are the best resource guides where they can guide what kind of prerequisites you have, what kind of grades you will be needing, what kind of special interests you have to do in terms of requirements before you go into, say, college and make the prerequisite for the medical entrance test. Having done that,
so just getting into any medical field, field within the medical area would require the same thing.
Same thing. When you go into, say, from high school, there are a number of internship programs that I would recommend him to do. Most medical schools have what we call an internship program or summer internship programs, where your child can, as a high school student, can participate in some form of patient care, not directly, but work with the physician in doing some involved in patient care, involved in research, can shadow a physician to see how it works like and do that. In fact, we have a high school student shadowing one of our clinical faculties who just visiting this physician and seeing how he deals with patient, how he works, how he evaluates family, how he orders labs, for example, and he's also quite interested in research. So that is a very good way to get your feet wet, so as to speak, to involve in that. Besides that, that's the practical experience. Besides that, there are specific requirements in terms of grades and special number of courses that be required that needs to be taken before they can go to the next step. So of course, the first step I would start would be to have approach a school counselor. The school counselor will dictate what kind of courses and efforts the child has to make in order to go into
be eligible to go into a
medical school or a pre-medical school.
Well, at what point in the medical school process do they choose a specialty? Like you chose psychiatry and then you chose child specialty within that.
Right. Well, once you go into medical school, most of the because the medical curriculum is divided into, say, broadly in two categories. One is a preclinical, where you have the basic understanding of body, for example, the anatomy of the body, the physiology of the body, pathology, various diseases are known to us, and that's the first 2 years. And the second segment is the third and fourth year. That's where the medical students get exposure to various clinical specialties. So they're required to rotate through different specialties, like example, surgery, medicine, OBGYN, psychiatry, and depending on what kind of experience they have on those rotations, the students are required to choose one. So it's something you decide about late second year, or maybe around third year time, what you want to do when you really graduate.
And as you begin to narrow down,
exactly. As you go to the medical school, you narrow it down.
And you said in an earlier program, you said that you chose psychiatry because there was some inherited
Right.
mental health,
Right, issue in my
like
family.
depression in your
Right.
family.
Right.
And then you narrowed it down further to child, which did not preclude adult
Right.
care,
Right.
but because you really were interested in getting
Right,
to
right.
the children.
Right. Because child is a specialty in psychiatry, when you go into residency program, which is additional training after your medical school
right.
to train in psychiatry, you do first 3 years, in some cases up to 4 years of adult training first. And once you are done with adult training, then you may or may not choose to go into subspecialty, which is a child. Children are more complicated to deal with, so you really have to know what kind of psychiatric symptoms an adult faces, and then graduate more towards children. So to divide that, you can do a combined program, which I did, 3 years of adult training, and after that you do 2 years devoted to understanding and dealing with problems, emotional problems in children and adolescent population.
So that just broadened your whole
That usually broadens
ability to care for
right.
patients.
Or you can decide that from adults you can want to specialize with geriatric population, senior citizens. So that's another offshoot you can do that.
Which is a pretty new field.
This is also a
dealing
very
with
new field
the geriatric.
and much in need,
Yeah, and because did I hear this from you, or did I read this in a magazine that suicides were the rate of suicides was increasing in the senior citizen population at about the same rate it is in the children's population.
Right. Actually, the rates of suicide has been the highest in a population, senior population 18 above, for various different reasons. Certain segments of the populations are more at risk, particularly 18 above Caucasian males, single or widowed, having a lot of medical problems or in chronic pain. Those are the populations are very high risk of committing suicide. What we have seen is that recently, and this may reflect why broadly on our society also, the highest rising rates of suicide is actually in the young adults, even teenagers, from 16 years onwards. So that has shown the steepest rise in rates of suicide.
We're going to have to take a break. We'll be back in just a minute and continue this conversation with Dr. Bobby Jane. Isn't this really good information that we all need to know? We'll see you in just a minute.
Stay tuned. West Texas View will be right back.